Hello, my name is Roger Watson and I'm the Professor of Nursing at the University of Hull in the UK. My clinical background is working with older people, including older people with stroke. In this session I'm going to talk about collaboration in stroke care, specifically about the work of the multidisciplinary team. I'm not going to talk so much about the acute early phases, but more about the rehabilitative phases of stroke. However, I don't want to imply that these are entirely separate. It should be noted that the rehabilitation of a stroke victim should begin as soon as they're admitted to hospital. A stroke is known as a cerebrovascular accident, and a cerebrovascular accident can arise for different reasons. The two main reasons are a blood clot in the brain, occluding the blood supply to certain parts of the brain, and this is usually associated with diseased arteries in the brain, but a stroke can also be caused by a brain hemorrhage, by blood leaking out into the brain. Whatever the cause, a stroke is a serious, life-threatening medical condition that occurs when the blood supply to part of the brain is cut off. Strokes are a medical emergency and urgent treatment is essential. The sooner a person receives treatment for a stroke, the less damage is likely to happen. Time is of the essence in the early stages of stroke. The consequences of stroke affect all parts of the body, but primarily the brain, and like all organs, the brain needs the oxygen and nutrients provided by blood to function properly. If the supply of blood is restricted or stopped, brain cells begin to die. This can lead to brain injury, disability, and possibly death. You should be able to recognize the early signs of stroke in someone. These are summarized as FAST, F-A-S-T. F for facial drooping or facial weakness, A for arm weakness, S for speech difficulty, usually slurring, and T, time to call the emergency services. And this should be done as soon as possible. Comprehensive stroke care always requires a great many departments of a hospital. Different hospitals are configured differently, so it may not be the same in every hospital. But someone with a stroke will always be admitted to the emergency department. They may then go to a stroke inpatient department, a specialist neurology ward, where they may remain for a short time or for a longer time. They may be discharged to a general ward. Departments such as imaging and interventional radiology labs will be needed for investigations and for treatment. Then inpatient rehabilitation before the person can be sent home if they do recover from the stroke. And all this is kept going, and the needs of the patient are met at all times by skilled nursing facilities. If someone does recover from a stroke, in other words, if they don't die almost immediately, then they will go through a period of recovery and rehabilitation. And people who survive a stroke are often left with long-term problems caused by injury to their brain. These can include physical and psychological problems. Therefore, some people need a long period of rehabilitation before they can recover and become independent again. Some may never recover and may need to adjust to living with the effects of their stroke. A period of stroke rehabilitation may be quite prolonged, and the patient who's had a stroke will have many needs. It's impossible to draw up a comprehensive list, and also any list which I present may not apply to everyone. Every stroke patient is different, they have unique needs and should be treated as an individual. So these are just some examples. So the patient's functional abilities, simply the ability to do very simple things that you or I take for granted, may well be affected, and this may include communication. The speech of a person with a stroke may be temporarily or even permanently disabled. They will have essential care needs, including things like washing, dressing, and help with going to the toilet and eating. This will arise probably because of paralysis down one side of the body affecting an arm and a leg, and they may never fully recover that function. Someone who's had a stroke will definitely have psychological needs. People with stroke become very emotionally labile. We might call it weepy. They become very easily upset. Their brain may also have been affected by the stroke such that their intellectual or cognitive abilities may be affected. People with stroke will have medication needs, and not just the need for a specific drug, but also their ability to look after themselves once they're home and any help that they may need to do this. So their ability to manage their prescribed medications needs to be assessed carefully, and often nursing staff in the community can help with this, or their relatives or significant others may be involved. The social circumstances of someone, and indeed of a whole family, may be affected by a stroke. They may not be able to return to their home, so they may need help with finding somewhere else, and they may not be able to afford the equipment that they need. These things will need to be assessed and taken into consideration. Their mental capacity, as has already been alluded to, may be affected. This needs to be assessed so that it's known whether or not the person with a stroke understands what is happening to them, especially if they're transferred to somewhere new or unfamiliar. Risk will need to be assessed, especially again if cognitive function is affected. If it is affected, they will be classified as a vulnerable adult and may come under the section of a Mental Health Act. And finally, plans for follow-up and rehabilitation and access to services out in the community, including health and social care and voluntary sector services once the person is discharged home, or at least out of the hospital. As I've said, it may not necessarily be to home. Other needs in stroke rehabilitation could include advice about continence. This is often affected in stroke. Dietetics, it may not be possible for the person with a stroke to eat the same diet as they did before. They may not be able to chew the same kind of food, so they may need some help with preparing food which is not only easy for them to eat but also nutritious. They may need electronic aids in their house, remote controls and things like this. This all costs money, and it needs to be assessed whether or not the person is able to understand how to use them and actually to use them properly. There may need to be some liaison with psychiatry services in the community to make sure that the person is looked after from the mental health perspective. Orthoptics, if their vision has been affected, and orthotics if they need any help with new kinds of shoes or any kind of help with balance once they're out. Obviously, pharmacy services will need to be involved because of their medication needs. And podiatry, very important that the person who's had a stroke has good podiatry services, that their feet and their lower legs are looked after properly. And finally, wheelchair services. A person with a stroke may never be able to regain walking ability completely and may require a wheelchair. However, this list is not comprehensive and again will not apply to everyone with a stroke. I must emphasize that everyone with a stroke is different and should be treated as an individual. It should be becoming clear that stroke rehabilitation requires a multidisciplinary team. Now, this is not a comprehensive list of people, and again, this may not apply to everyone. Every stroke victim should be treated as an individual and assessed and treated accordingly. However, the multidisciplinary team will almost certainly involve consultant physicians who are specialists in stroke care, and likewise nurses who specialise in stroke care. At some point, it's almost definitely the case that physiotherapists will be involved with stroke victims, and this is to help them to regain their physical function as well as possible. And likewise occupational therapists to help them to return to a home or a new home environment, and to help them to cope with activities of daily living and to rehabilitate them in activities of daily living, and if that's not possible, to help them with adapted furniture and adapted cutlery, adapted clothes, and so forth. Speech and language therapists may be needed not only to help with speech and language, but also to help with eating and swallowing. Clinical psychologists to help with the mental health aspects of rehabilitation, returning home or returning to a new environment and not being able to cope well leads to many problems, and clinical psychologists can help people to overcome the mental health problems that are associated with that. Rehabilitation assistance will be required, and finally, to help with the financial aspects, social workers. The most important person in the multidisciplinary team is the patient, and they should always be at the centre, whoever else is involved in their multidisciplinary team, which of course can include neurology, social work, occupational therapy, physical therapy, and speech therapy, and not forgetting nursing. The patient is the most important person. They should be at the centre. A successful interdisciplinary team takes planning, organisation, and leadership. And the features of a successful interdisciplinary team are that it works collaboratively and it fosters supportive relationships, not only with the patient and their family, but amongst members of the team. A good interdisciplinary team has strong, committed organisational and team leadership. There should always be an identified leader of any multidisciplinary team, and that multidisciplinary team will depend on the patient, and it may be a different person for each patient. It isn't necessarily always the doctor. There should be a diversity of expertise, and the team members should be tailored to the specific circumstances, either locally and especially for the individual patient. They should have shared goals and a shared approach to ensure a consistency of the message that they're trying to get across. People working with the multidisciplinary team shouldn't be receiving different messages from different members. They should, as it were, sing from the same hymn sheet. They should have clear and open communication within the team and also with the patient. There shouldn't be any barriers there. And the patient should be at the centre of decision making, of course. There's no shortage of literature on the work of the multidisciplinary team in stroke rehabilitation, but I thought this article on multidisciplinary care from Progress in Neurology and Psychiatry by David Clark from the University of Leeds in the UK was particularly good. In the article, David says, stroke teams in hospitals are made up of what can be thought of as core and periphery members. Core members are normally based on stroke units or less commonly in an ESD team, that's an early supported discharge team, which may be based on an inpatient unit or in a community setting. The core group includes physiotherapists, occupational therapists, speech and language therapists, stroke physicians, nurses and healthcare assistants. So that's the normal or usual composition of a core team. I would imagine it might often include social workers as well, but anyone else outside that team would be considered peripheral to the team. So that's the core team: physiotherapists, occupational therapists, speech and language therapists, stroke physicians, nurses and healthcare assistants. There's also some literature on multidisciplinary team meetings in stroke rehabilitation and how these work best. This article in Clinical Rehabilitation by Tyson et al. Said the following. Successful meetings tended to feature a set agenda, structured documentation, formal use of measurement tools, pre-meeting preparation and skilled chairing. In other words, these meetings didn't take place or they didn't work by chance. They were planned and well managed. So in conclusion, that's a very short introduction to team working in stroke care. But in conclusion, just to remind you that stroke is life-threatening. Survival usually necessitates prolonged rehabilitation. Rehabilitation requires a multidisciplinary team. The patient should be the focus of that team. Every stroke patient has different needs. Multidisciplinary team care requires coordination and collaboration does not happen by accident. Thank you very much for listening. That's my email address. You can check me up on ORCID to see my publications and my research record. You can follow me on Twitter, and I'm also on WeChat. Once again, thank you very much for listening to this session.